Welcome back to our channel. I'm Dr. Reymunde, a PAK Pediatrics pediatrician. Before getting on with today's topic, I want to remind everybody to please click that subscribe button and alert so that you are notified of new content when it comes out, as we plan to create a lot of great videos for you guys. Okay, let's get to the good stuff. We have been getting some questions about the measles outbreak that's been going on in Ohio. So today, let's talk about measles.
PAK Pediatrics presents.
I'll go over the top 5 things parents should know about measles today. Number 1, what measles is. Number 2, the symptoms and complications that could happen. Third, why the increase in cases matter. Fourth, should we be worried? And finally, fifth, what it means for us and our children. So, measles is a highly infectious viral infection, which means that antibiotics won't work. Which we don't really see that much measles in the US anymore due to our high vaccination rates and the efficacy of the vaccine. In fact, back in 2000, it was considered eliminated in the United States. We still can see cases, however, due to the spread by unvaccinated travelers to areas in the world where measles is still present. Then they will bring it back to the US. Now, the most common symptoms of measles are very similar to other respiratory infections or colds, coughing and sneezing. But measles is characterized by high fevers, which can be as high as 105. And it also has a triad of cough, conjunctivitis, and a really bad runny nose. There's also a very specific rash associated with it and a specific rash inside the mouth. In severe cases, measles can cause permanent complications from pneumonia, seizures, brain damage, and even death. There is also a huge concern for pregnant mothers. You can spread measles about 4 days before you even get symptoms, and it can take up to 12 days before you are exposed to have symptoms. As of December 12th, there have been 73 cases of measles, up from 13 in 2020, that have been recognized in Central Ohio, and this seems to be spreading. 24 of those cases, or 36%, are hospitalized. All of the cases have been in unvaccinated or partially vaccinated people. 70% of those cases are in children under 5 years of age, and half of them are between 1 and 2 years old. This is significant because there has been an increase in the number of unvaccinated children in recent years. Children are typically vaccinated against measles at around 1 year of age and get a second dose at around 5 years of age, right before kindergarten. There are 2 major reasons why I feel people have not been vaccinated or have not completed the series. First, the COVID pandemic has caused delays in vaccination due to closed doctors' offices, decreased access to doctors, or patients choosing to remain in isolation until it's maybe a little bit safer to venture out into the world. Second, some families simply choose not to vaccinate or choose an alternate vaccine schedule or use homeopathic vaccines that may not be as effective. What this means for our community is that if you and your child have completed the measles vaccination, then the chances of being affected by measles are extremely unlikely, around 1 in 1,000. If, however, you have not been vaccinated or you have not completed the vaccination series, you are at much higher risk and should be cautious and should contact your doctor if you're experiencing any cold symptoms and remind them that you are not vaccinated or have not completed the measles vaccination series, as there are options for medications after you have been exposed. Also, if you do have measles, you should isolate for about 4 days after the rash develops. It is extremely important to recognize cases early and to provide treatment and isolation in order to prevent those severe complications. Even though the severe complications may not be as common, it is still devastating to the families that they do happen to. That's it for this video. Thank you all so much for watching. Stay healthy and make smart choices.